the second of the skills. Okay. You mind taking down your
My hair.
just for that. Okay. So the thing that the instruments that you will be needing here will be your stethoscope. Okay. So the first thing that we need to assess will be the scalp. When we talk about the scalp, it's going to be the entire head. So looking at the scalp, okay, the head, we first assess the size, and we said that it's normocephalic. When we say normocephalic, the size of the head is appropriate to the rest of the body. Okay. Now we'll note that there is symmetry. So if we were to divide the head into a right and left, you would note that the left is equal to the right. Okay. Now in terms of the shape, we say it's rounded. Okay. And when we assess for the consistency, okay, we make sure that we again palpate. So start again from the top, okay, using the index and middle fingers. Make small circular motions to assess for any masses, what is the consistency of the scalp, okay, any pain. Okay.
That's good.
Stay awake.
Free massage.
Okay, so there are no masses. The scalp is firm, or it's hard. It's smooth. You may feel parts of the bone, but that is a normal finding. Okay. Okay. And then lift the hair to assess now the hairline for any lesions. Okay. So that will be for our scalp. Now we assess the face. Looking at the face, you'd note that the color of the face is what they call this. It sorry. It is the same color as the rest of the body. Okay. Let's check the in terms of the what they call this, the symmetry. So again, look at the eyes. They're on the same plane. Okay. Hopefully not one is higher or lower than the other. Look at the ears. They're on the same plane. Okay. The nose is at the midline, together with as well as the lips. Okay. So again, if you were to divide this, right and left, equal. Okay. Now we assess the facial features in terms of the facial expressions. So here you need to be standing in front of your patient so you can observe the facial expressions for symmetry. So we ask the patient to smile. Symmetrical?
Mm-hmm.
Yes. Okay. Please pout. I was pouting. Everyone else is smiling. Okay. Now please raise your eyebrows.
And both.
Of course. Okay. So observe for symmetry. Puff your cheeks. Okay. And close your eyes tight. Okay. So these are the different facial expressions. Observing for symmetry. So again, smile, pout or frown. Okay. Raise your eyebrows. Puff your cheeks. And close eyes tight. Okay. So these are the facial expressions. Okay. Okay. Then we inspect now the neck. So look at the neck, observe for any bulges, any masses. Okay. You'll note that it's at the midline. It's able to support the head. Okay. And we do not observe any masses. Okay. So we now check for and you'll note that the color of the neck area is the same as the color of the face. Now we'll assess the movement and strength of the muscles involved in movement of the head and neck. Okay, so we ask to assess for the sternocleidomastoid, the SCM. Okay, we ask the patient chin to chest. Okay, then we ask the patient, Leslie, can you please push against my hand? Okay, so you try to push back, you try to push the head back to the midline, And that will be when the patient resists or applies an opposing force to keep it at a flexed position, that is now assessing for muscle strength. Okay, now back at the midline. Okay, this is extension. Okay, we do not assess muscle strength. Now, please look at the ceiling. Hyper extension. Again, assess muscle strength. So resist. Push the head back towards the midline. You are pushing it back to its normal position, not pushing it back. Okay, so that is hyperextension. Now back at the midline. Now please bring your right ear to your right shoulder without moving the shoulder. Right ear to right shoulder. There you go. Okay, assess muscle strength. Okay, now at the midline. Left ear to left shoulder now. Muscle strength. Okay, midline. Now this time, can you turn your head to the right? Okay, assess muscle strength. And then to the left, assess muscle strength. Okay, so again, you cannot give instructions when you're doing the exam. You cannot give instructions, flex your head, hyperextend. You need to give simple instructions. This is on the premise that your patient is not a medical professional. Good. So chin to chest. This is flexion. Assess muscle strength. Now look back at the midline. Now look up at the ceiling. Hyper extension. Assess muscle strength. Now midline again. Now right ear to right shoulder. Muscle strength. Left ear to left shoulder. Muscle strength. This is lateral flexion or lateral bending. Okay. Now can you turn your head to the right? Muscle strength. To the left. Muscle strength. And this is rotation. Okay, so these are the movements for the sternocleidomastoid. Now we ask the patient, can you please shrug your shoulders? Okay, assess muscle strength by pushing it down. Okay, so when we ask the patient to shrug the shoulders, this is to assess the trapezius muscle. Okay, and the sternocleidomastoid and trapezius, when we assess the function, is also an assessment of cranial nerve 11, which is spinal accessory nerve. Okay, all good. That's for the neck. Now we go into the different structures. So we start with the temporal artery. So this, like I said, you will be standing in front of your patient. Okay, here. You will feel that this area here, there will be like a small, slight depression. Okay, assess. Any pain?
No.
Okay, no pain. Okay, it's not palpable, so the temporal artery normally will not be palpable. Like I said, in older individuals, you may be able to feel that it's hard or it's thick. Okay, now we will need to auscultate. So when we auscultate, we use the bell. We'll listen for bruits. And whenever we use the bell to listen for abnormal sounds, we have to apply it lightly on the skin. Okay. Okay, so no bruits are heard. Okay, that's for the temporal artery. Palpate and then auscultate. And then we do the assessment of the TMJ, the temporomandibular joint. And like I said, your landmark will be the tragus of the ear. So the tragus will be this. This. Okay. So anterior to the tragus, this is the tragus. Anterior to the tragus, palpate. Okay. Now, any pain? Okay. Now, you ask your patient, Leslie, can you please open your mouth wide? Okay. Well, you continue to palpate. And we said the patient should be able to open the mouth and the distance between the upper and lower teeth should be 3 to 6, what?
Inches. I mean centimeter.
Inches ago. Okay, 3 to 6 centimeters. And again, continue to palpate, checking to see if there's any click. You you'll hear this or feel it. Or sometimes a crepitation, like I said, it seems like the bone is, rubbing against the other bone. Okay, so continue to palpate. Okay, so now this time, Leslie, can you move your lower jaw to the right and to the left?
We can do that.
Okay, okay. Oh, that's good. All right. So any pain when you do that? Again, when you ask the patient to move the jaw to the right or the left, what is the distance in both, in each direction? 1 to 2 centimeters. So the patient should not have any limited movement when opening the jaw and when moving it to the right or left. Okay, TMJ. Questions? Next, we now assess the trachea. For the trachea, we start our assessment from the chin, feeling now slowly until you're able to feel the thyroid cartilage. So the thyroid cartilage is this bigger cartilage. It contains, or it is the Adam's apple. Okay. Now, so you will note that it goes this way. Okay. And then moving your fingers lower, the smaller cartilage will be the cricoid. And moving the fingers a little lower, you will feel the rings. It's very prominent. The rings of the trachea, the C-shaped cartilage rings of the trachea. Okay. Now, we observe for movement of the trachea by asking the patient, can you please swallow? Okay. So you will note there will be the upward movement, the upward deviation of the trachea. You will observe there is no deviation of the trachea to the right or to the left, and there was no pain or tenderness when you palpated. Okay. Next, we now assess the thyroid. When assessing the thyroid this time, you need to stand behind your patient because we are doing the posterior what they call this assessment. So here we ask the patient, okay, Leslie, can you turn your head a little to the right and then drop it? Okay. When the patient turns to the right, we are assessing for the right lobe of the thyroid. So it's like you're going to strangle your patient, but you're not. It's like, okay? So feel for the trachea here, okay? Push it gently to the right. Push it gently to the right, okay? Now with your right index and middle fingers, palpate now. Put up your head a little. Okay, there you go. Palpate now for the right lobe of the thyroid. Okay, any pain? It's not palpable. Okay, now we ask the patient, can you please swallow?
It was a hard swallow.
Okay, now when the patient swallows, you'll feel the trachea move up. Okay, you will feel it move up. Okay, there is no lag. You will, because her right lobe is not palpable in the first place. Okay, now this time, we ask the patient, can you turn your head a little to the left and then drop it just a little. Okay, this time now, feel for the trachea on the right side. Push it gently towards the left. This is to make the lobe more prominent on the opposite side. So, pushing, palpate now the left lobe of the thyroid. Okay, any pain? It's not palpable. Okay, now can you please swallow? Okay, you can feel the movement of the trachea. Okay, so after we do the palpation, we now auscultate. Okay, so again we use the bell, applying it lightly on the patient's skin. Okay, this time you need to ask the patient to hold her breath, because like I said, you do not want to mistake the breath sounds for brutes. Okay, please take a deep breath and hold. You can actually try it, ask the patient to hold her breath, and then when she relaxes, you'll hear the ingress of air. You'll now be able to, oh, this is how a bruit sounds. Okay, so there's no bruit heard. Okay, that is now for the thyroid. Questions? Now the last part will be for the assessment of the lymph nodes. To assess the lymph nodes, like we said, it's a chain, it's not just one, it's a chain of lymph nodes on different areas of the face as well as the neck. Okay, now we assess for the size, if it's palpable at all, for the shape, for the lineation, meaning can you feel the borders, the edges of the lymph node? Is it movable? Okay, is it smooth? Okay, and then of course if there is any pain or tenderness. Okay, so now you'll be standing again in front of your patient. The only reason why I'm here is so that you can see it. Okay, so we start with the pre-auricular. Feel it. Okay, and then post-auricular. Can you turn around a little more so that they can see? Okay, post-auricular is behind the ear. Okay, feel. And then occipital will be here, along the hairline. You have to do both hands, but I cannot because her hair is down. Okay, and then let's face them again. Okay, this time we assess submental. If your patient has a small face, you just use 2 fingers of the dominant hand. Submandibular. The jawline, jugulo-digastric, the angle of the jaw, anterior cervical, posterior cervical, here you need to go a little deeper, and supraclavicular. So again, you have pre-auricular, post-auricular, occipital, submental, submandibular, jugulo-digastric, anterior cervical, posterior cervical, and you have supraclavicular above the clavicle. Okay, so again, if you feel any lymph nodes with Leslie, there are no palpable lymph nodes. Okay, so this is the assessment of the head, neck, and lymph nodes. Questions? None? Okay, so you practice until 2:30, and then we start with the eye assessment at 2:30.